Hello! Today's topic will be about hemorrhoids. We will learn what hemorrhoids are, how they form, their types and degrees, and we will explore the best ways to get rid of them. If we take a look inside the rectum and anus, we will notice that this area contains many blood vessels that supply it with blood. Additionally, there are glands inside the rectum that secrete certain substances to aid in the process of stool passage. Hemorrhoids are when the blood vessels in the anus or inside the glands become inflamed, swell, and protrude. The part that protrudes is called hemorrhoids. We have two types of hemorrhoids: internal hemorrhoids, which occur inside the anus, and external hemorrhoids, which appear as an inflamed mass of tissue outside the anus. Doctors classify hemorrhoids into 4 grades. First degree, the tissues are inflamed but not prolapsed. Second degree, the tissues are prolapsed and protrude from the anus but return to their place again. The third degree, the hemorrhoids are prolapsed and come out of the anus but do not return to their place unless the person pushes them back with a finger. The fourth degree, the hemorrhoids are significantly enlarged and come out of the anus and do not return to their place no matter how much the person tries to push them back. And this degree is very painful. However, external hemorrhoids are easy to identify just by looking at them because they are outside the anal opening. Most hemorrhoid patients are diagnosed in the 3rd or 4th stage. This is because most patients are embarrassed to complain about that area. One of the most common causes of hemorrhoids is straining or exertion during bathroom visits, whether due to constipation or chronic diarrhea. It can also occur from lifting heavy weights, as this also causes straining and pressure on the body. Sometimes hemorrhoids occur during pregnancy or obesity because the increased weight puts more pressure on the muscles of the anus. Doctors have noticed that most cases of hemorrhoids were suffering from constipation for a long period. And we have 4 methods to treat hemorrhoids. The first method is using medications like laxatives and pain relievers, whether they are pills or creams, applied inside the anus. We ask the patient to sit in a warm water bath for 15 minutes and repeat it 4 times a day. The second method is using a rubber band. The surgeon inserts a rubber band similar to an elastic and places it around the swollen area. The elastic here compresses the neck of the swollen area, preventing blood from reaching it, and thus the tissues begin to die and fall off, and the area naturally heals over time. The third method is using laser. The surgeon inserts the laser into the swollen part and begins to cauterize the tissues and veins. This cauterization process burns the hemorrhoids and prevents bleeding at the same time. After cauterization, the tissues begin to atrophy and disappear. The fourth method is surgery, which we resort to when the hemorrhoids are severe or complicated, where medications, the compression band, or laser cannot be used. During the surgery, all the swollen and inflamed veins and tissues inside the rectum and anus are cut. And after removing the hemorrhoids by any of the methods we mentioned, the patient takes laxatives for a period and adjusts their diet to include more fiber-rich foods and drinks plenty of water to avoid constipation. They also reduce spicy foods and spices to prevent inflammation in the anal area.